in the chat.
Okay, sure.
If someone asks a question in the chat and you would like me to answer it, could you just pause me and say, hang on, Jonathan,
Okay.
we have a question, and I'm happy to answer questions. And so I'll try to leave time for questions at the end, but I might not. I talk a lot. Also, I know many people attending this lecture speak many languages. And so if English is not their first language, maybe I'm talking too fast.
Yeah.
It's okay to just tell me slow down.
Okay, sure. Thank you so much.
Yeah, I don't mind. I won't be offended.
Thank you so much, Doctor.
Okay, so should I get started?
Yes, Doctor, please.
Excellent. Okay. Let me share my screen.
Yeah, okay. I give you the share, just 1 minute. So
okay.
I will just make host. Yes.
Excellent. Okay. Okay. Okay, let's see. That's strange. I don't actually see the button to share my screen. I see a whiteboard. Well, let's see. Oh, okay. I found it. I think. No, I don't. It only wants me to share a whiteboard, not my screen or the PowerPoint. That's strange. Maybe presenting. No, that's not correct. Okay. Strange.
Okay, Doctor. There is a solution. If you like, you can send. If it's okay, you can send the slides, and then I can just try to move it from here. So if this works.
Okay. Yeah. Let me. I'll drop it in the chat, and then you can download it from there.
Okay. Yeah, definitely, Doctor. Thank you.
Okay. No problem.
Okay. Sorry.
And while we're waiting, I wonder, is there anyone attending who is from the country Jordan?
From Jordan, I think there are lots of Jordanians.
It was my great honor to visit the country of Jordan, maybe about
it's
7 or 8 years ago. Beautiful country.
Beautiful country, yes.
Yeah.
So, okay, let me check. So have you sent it, Doctor, or not yet?
I'm sorry?
Have you sent the slides? Because I didn't.
Let's see. Okay. Yeah, now it's downloading in the chat.
Yeah, okay, good.
I dropped it, but I didn't click send. Sorry.
It's fine, thank you. And we hope you come to Egypt also.
I would like that. That would be great. We should talk about that.
Yes, sure. You are welcome. And all of us are your students, and we are learning from your the amazing researches that you published and the books. Thank you so much.
Thank you. Yeah, an Arab ABA conference or meeting in Cairo would be incredible. That's a great idea, Marwa.
I'm just waiting to receive it because up to now, yeah. So maybe it's taking time, but it's fine.
How about Lebanon? Are there any attendees from Lebanon?
Yes, I think so.
That's great. I've always wanted to go there too. Yeah, Lebanese food is some of my very favorite food. I'm sure it's different here in America, but it's really good.
yeah, especially the tabbouleh, which is a type of salad. So I love it. And
so
the
good.
Lebanese flavors also is very nice.
Okay, do you see it now? Did it come on your side?
No, I didn't receive it till now.
Oh, I sent it only to one person, not to you. I sent it to the wrong person. I'm sorry.
Okay,
that's my fault.
fine.
I can fix it now.
Okay.
Foolish. I apologize. Okay, now it's coming a direct message to you, Amr, in the chat. Okay.
Just 1 minute.
And it's downloading. Ezra says, I haven't tried Egyptian food. No, not yet, but I would like to. Did it come through on your end now?
Yeah, just 1 minute. I will just.
Great.
Yeah, it's here. So just download it.
Stuffed grape leaves. Yeah, there's many Mediterranean restaurants in the United States that serve. They're usually called dolmathes. Maybe that's a Greek word. I don't know, but it's the kind of stuffed grape leaf. Delicious.
Yeah, just 1 minute. I will. Okay. Just 1 minute. There is something wrong with the setting. I will just try to, because it doesn't allow to. Okay, to share. 1 minute. There is something wrong with sharing. I don't know how to solve it. So
okay.
So
well, if you want, I can just talk. I don't need to use the slides.
Okay.
And
sorry for
again,
this one. Yes.
No, it's okay. People can ask me to pause and answer questions, or if what I'm saying is not clear, I can repeat, and I can save the slides as a PDF that you can email to everyone afterwards, or maybe now.
Yes,
Is it fast to email? I'll drop it in the chat right now, so everyone can follow along if they want to.
This is great. Okay.
Okay,
So
let me do that. Okay, so now everyone will be able to get the PowerPoint slides in the chat. It's uploading right now.
Yeah.
And so I'll just start now, and then people can open it and follow along.
Yeah, thank you so much.
But also, yeah, no problem. And if it's distracting to do the slides yourself, it also works to just not worry about the slides, and we can just have a conversation too. Whatever works for people. Okay, great. So yeah, let's get started. I just am really happy to talk about this topic of compassion. I think it's really, really important. For me, in many ways, it's the most important thing. Maybe it's more important than anything else that I do. So I really appreciate this opportunity. So I'm going to talk a little bit about compassion specifically as a foundation for what we do in ABA. I'm going to talk about some procedures that we can use for self-reflection to enhance our own compassion, and then talk about a few specific procedures and concepts that we can use to make what we do more compassionate. So first, my concept of compassion that I use is called radical compassion, and it comes from various spiritual and religious teachings that say that all human beings are deserving of compassion simply because we are human beings. And so radical compassion means it is my duty and my honor to give compassion for you simply because you are a human being. You don't have to earn my compassion. There's no behavior that you have to do to earn my compassion. My compassion is not a positive reinforcer that is contingent on your behavior. My compassion is a connection between me as a human being and you as a human being. So this is the perspective that I'm taking. I'm not saying everyone has to agree with that, but that is one approach to compassion. And if we look at the basic spiritual teachings across thousands of years, across all cultures, across all major world religions, and regardless of language, all human spiritual traditions have put compassion at the foundation. And I know I am no expert in Islam, but I have many Islamic friends and colleagues, and they say that mercy and compassion is the foundation of Islam. And so I don't know that myself, but I believe my friends who have told me that. And I do know that for many other spiritual traditions as well. And so the problem that we face today, and I don't know if this is true in the Arab world, and I know that all cultures are different, but in the Western world and sort of US ABA culture, there are people who do not understand that we're leading with our hearts. There are many people who think that ABA can be cold or rigid or strict or punitive. And there have been old versions of ABA in the past that were overly punishing and overly strict and rigid. And if you've heard from Greg Hanley, you already know that those days need to be in the past. It's time for us to move on. And compassion is a very important part of how we can move forward. And so I have worked in the field of ABA for 24 years, 25 years, and in my whole career, I have known hundreds, maybe thousands of professionals in ABA who genuinely care about the families who they help. I have no question that we are in this field to empower other human beings and help them. That to me is obvious. And also, it's not always obvious to everyone else outside of ABA. And so it's our job to make that clear, to lead with our hearts so that the human beings who we work with, they know immediately that we care about their well-being and their dignity more than we care about anything else. And so and again, I know every culture and every region is different, but there has been some research where they interviewed parents of autistic children who are getting ABA services in the United States in English. And they asked questions like, does your behavior analyst understand your fear and your anxiety about your child's future? Does your behavior analyst understand what you struggle with in parenting your child? Does the behavior analyst acknowledge your feelings when discussing difficult or challenging circumstances? And unfortunately, the majority of parents who were working with a BCBA said, no, the BCBA does not understand how I feel. And so that is feedback for us as a field. Those are data that we can use to help us be stronger and help us become more compassionate and take better care of the human beings who we are trusted to nurture. And I know that that will look different in every culture, in every region. But I think that the desire of parents, of mothers and fathers to be cared for by ABA professionals is universal. So what is compassion? What do we mean? How can we talk about compassion from an ABA standpoint? And there's an article by Taylor, LeBlanc, and Nozick in 2019 that uses a definition that is very useful. And they say, compassion converts empathy into an act aimed at alleviating someone else's suffering. So compassion has two parts. The first part is noticing that someone else is suffering, and then maybe feeling that a little bit. So that's the empathy part. And then the second part, empathy by itself is not good enough. The second part is doing something on the outside, overt behavior that we choose to do to help decrease that other human being's suffering. And so the approach that I'm suggesting is that this is the foundation for everything else that we do. So that when we walk through the door to work with an autistic child or to work with parents or whatever population you work with, the very first thing we do is be present with that other human being and be a witness to what they're experiencing and what they're struggling with. And when we notice their struggle, their suffering, we share that a little bit. And then we take action. We make a choice right there in that session every day to do something kind and something nurturing for that human being. And of course, something that they will receive and perceive as kind and nurturing. So compassion is not pity. Compassion and pity are different. But it kind of, because you're sort of worse than me or suffering more than me. Compassion is different. It's choosing to share that person's struggle and then do something to help. So that same article by Taylor, LeBlanc, and Nozick, they have 4 different categories of compassionate behavior that they recommend. One is having positive interactions. Another one is demonstrating empathy, like showing the other person that you're feeling empathy for them. The third one is demonstrating compassion, so taking action to help. And then the fourth one is collaboration, so being cooperative. So when a parent says that they want something, we don't just say no. We are willing to talk about it. Even if we think that the parent's idea is not a good idea, maybe they want something for their child that we really believe will not be helpful, but we start with the assumption that the parent is right about their perspective, that we can never know the parent's dreams and wishes and desires better than they know, because it's them. It's we cannot know them better than they know them. And so collaboration. So these are just 4 general categories of behavior. And then their article, they list a table with, I think, 35 different specific behaviors. And so this article, and I have a slide, but it's slide number 9, and you can download the article for free if you Google it. This article lists many, many different behaviors. These are behaviors that we can just start considering in our practice. And when we're training our staff, we can try to define those behaviors, and we could say, okay, let's practice these behaviors. And so we can role play. If a parent challenges you and says, I don't think your recommendation is right, I know my child better than you, we can role play and practice. How do we respond to that challenge? Even if the parent is sort of attacking our authority or does not think that we're competent, how can we respond to that challenge in a way that demonstrates that we care about them, even when they're not being kind to us? So we can stand up for ourselves. We don't have to beat ourselves up, but we can do it in a way that shows kindness and compassion to that human being. And so just some suggestions are things like confirming the parent's emotional response in a non-judgmental way. So if the parent says, I'm just so tired, I'm so stressed out, I can't handle this anymore, then we can say something like, I hear you, that's got to be really hard. I'm sorry that you're feeling like that right now. And we don't have to tell them that they shouldn't feel that. And we don't have to argue with them, or we don't have to explain how everything is actually good. If the parent is struggling, that's a real struggle for that parent. And so we can confirm that we hear them and that we feel it, even if we don't agree. Sometimes we may disagree, but we can do it in a way that is kind and nurturing. So we've talked about, my colleagues and I have talked about some different sort of models for increasing our own compassionate behavior in ABA. The practice of self-reflection is very, very powerful. And so there's a whole chapter on self-management in the Cooper, Heron, and Heward book, the gigantic white book, you know, the sort of main textbook in ABA. And self-management is just about identifying what we care about, identifying behavior change that matters to us, and then noticing, assessing our own behavior, and setting a goal, trying something new, and observing, how did that work? Did this new behavior work? And so we are suggesting that this same model we can use as professionals in ABA to empower ourselves to behave with more compassion with the human beings that we work with. So the simplest question we can ask ourselves is, before we're just about to do anything in our job, we can ask ourselves, is this procedure, is it possible that we could do it in a way that is more compassionate? And this might be for choosing which behaviors to change. Autistic people have many beliefs about which behaviors they want to change or don't want to change. Are we listening to those beliefs? This could be for procedures I'm using. So if we're using extinction or differential reinforcement or punishment, we can ask ourselves, is it possible to do the same procedure, but in a way that is more kind or nurturing? How about for our staff? When we're training our staff, or we're giving our staff feedback on their performance, is it possible for us to reflect on how we do that? And is it possible to give feedback in a way that is still correct and gives important information to empower that staff member to change their behavior, but in a way that makes them feel nurtured and safe, and in a way that inspires them, instead of creates fear of failure? And then, of course, in how we interact with parents as well. And then we might want to think about, like, why would we do this? Why is it important? What's the function of our own behavior as ABA professionals? I'm sure all of you are thinking about the function of your client's behavior when you're doing behavior management, right? Is it attention? Is it escape? Is it a synthesized function? But what about the function of our own behavior as professionals? Why would we be more compassionate? And so the reason that many authors write in articles on compassion is, if we are more compassionate with parents, then they will feel more taken care of and they will do what we say. So if we are more compassionate with parents, they will be more compliant with our demands. So they will implement their child's behavior intervention plan. They will collect data on their child's behavior, and all of that will help the child and improve the child's outcome. And I think that's true. That's important. And also, there's another function for us to consider, and that is alleviating that parent's suffering in itself is a reinforcer for us that is maybe even higher and more important than simply getting the parent to comply with what we ask. So yes, parents doing what we ask is very important. And also, in addition to that, maybe us just showing up for them to make their life a little bit less aversive and a little bit more empowering, just that is a good enough reason, even if it wouldn't make any other real change. And so you can see on slide 13 and 14, I just wanted to share some pictures of some nurses in hospitals doing some behaviors during COVID-19 that it's clear the only reason they're doing these behaviors is to alleviate someone else's suffering, is to show love and care and nurturance for another human being. And so I think that we can do that too in our field. And I think we already do, but it's very often in the field of ABA, very often we focus on the data, the protocols, the rules, the behaviors, and that's good. We need all of that. But if we focus too much on that, it's possible that we forget to focus on the heart, the whole heart, and the whole human being who's standing across from us. Okay, let's talk a little bit about empathy. And so I'm on slide 15 now, if anyone is following along. And empathy, we talked about empathy as sharing another human being's feelings or emotions. And so if I see a mother feeling sad about their child, I might feel sad also, just a little bit. If I see a father feel frustrated that his child is not making more progress, I might feel some frustration also in my heart. So what is that? How do we include that in ABA? And the topic of relational frame theory is a newer concept in ABA, but it's a very, very powerful concept. And so if you haven't, Amr, if you haven't already had someone give a lecture on relational frame theory, I recommend it. It could be very useful. And there's some good new books coming out, only in English, unfortunately, but they're still good.
We can get some recommendations from you, and then we can invite, and that is more than amazing.
Yeah, probably the best person to invite is Siri Ming. Okay. And Amr, if you email me afterwards, I'll connect you too.
Definitely. Okay. Thank you so much. I appreciate it.
No problem. And so what relational frame theory tells us is that our behavior of relating ourselves to other people is a behavior that is learned, and it's a behavior that can be strengthened through practice. And so, and this is good and bad. And so in situations where authority figures want human beings to be unkind to each other or to treat each other badly, they will use language that tells the human being to relate themselves as different from the other person. Like they're bad, they are less than, they are different, they don't share your same values. And in war and in social conflict, this is the foundation of conflict, is us against them. We are different from them. I am different from you. And I don't need to give any specific examples because you've heard many, you know all of the examples in real life. It's happening right now in the United States with our politics, and I'm sure it's happening in your region too. You know this, right? And so the power of human language is that we can do the opposite of that. We can turn our language around and create opportunities for us to relate to other human beings in terms of how we are the same or very, very similar. And so we've actually done some research showing that when we take the time to ask ourselves, how is this person like me? Do they care about something that's similar to me? Do they want the same things that I want? Are they committed to something that I am also committed to? And when we take the time to engage in that perspective taking in terms of similarity, that increases empathy. And so that actually will increase the amount that we are willing to suffer to help other human beings. And so this isn't just a theory. This is a practice that we can all do. And so, for example, we could do things like, if we're working with an autistic child and the child's really struggling, we might take a pause, take a deep breath, and ask ourselves, how is this child, how are their struggles similar to my own? And so many of us in the ABA field, we may have had difficulties in school when we were a child. Maybe we had a learning disability. Maybe it was very difficult to learn math or reading. Maybe we had difficulty socially with making friends or fitting in. All human beings struggle. Struggle is fundamental. And so maybe we can find ways that our clients' struggles are similar to our own. And then just asking a question like, what would it be like? So when I was a child struggling and I was young, what would it have been like if someone treated me the same way that I am treating my autistic client in ABA today? How is that similar? How is it different? And how would I feel? And so when things are going really well in an ABA session, we're using lots of positive reinforcement, and the client is really motivated and excited to learn. They're making eye contact and they're moving towards you, they're laughing. We know, right? If we were that client, how would we feel? Happy. And it would be great, right? And then when things aren't going well, and maybe the procedures we're using aren't working, and we haven't changed them when maybe we should have, and the client is crying or screaming or struggling, how would we feel if we were that child? And when we put ourselves in their shoes, it increases how much we share their feelings. And it can make us stronger. It can hurt a little bit, but it can make us stronger because it can empower us to choose different behaviors, to make our procedures work better for this child and to make them feel more loved and supported, even while we're still doing all of the hard work. And when we're working with parents, when we're doing parent training, asking a question, asking myself, how am I kind of like this mother? One of the most common complaints I hear from BCBAs is the parent doesn't respect me, or the parent doesn't understand, or the parent is totally different. They want totally different things for their child. And so just asking the question, like, how are we similar? Maybe they are really different, but is there anything that's similar? And every single family I have ever worked with, even the most difficult parents, there's one thing in common. There's always something. And usually it's something very simple, like they want the best for their child. And we also, as professionals, we want the best for their child too. So there's always some common ground. Okay, I want to talk a little bit about just a few procedures from acceptance and commitment training, because I have found them to be very, very powerful for helping us be more compassionate in our ABA services. And so I'm on slide 21 now, and values for me are the most powerful procedure. And it's simply just reflecting, spending time reflecting on what do we deeply care about the most? What is most important to us? Not what specific outcomes we have to produce, like we have to collect data, or we have to write a report, or we have to complete 2 hours of a session. Those are like specific, tangible goals. Values are more like general concepts of what we truly care about. Values are what give our work meaning and purpose. And so values are different for everyone. But if we spend a little bit of time really reflecting on these, it can make us so much more powerful in being compassionate. And so for me, the sort of clearest words for me that help me connect with my own values are that I care about creating the opportunity for others to be their most incredible, creating the opportunity for others to thrive and to have their best life according to what they care about. That's just me. I'm not telling you that that needs to be your value, but I've spent a lot of time reflecting on that and just asking myself and writing. And that helps me when things get difficult. I can bring those values in, and it helps me do a better job. Now I'm going to ask you to do a little values exercise. And so if you're willing, I want you to fast forward in your career and maybe travel through time in the future until you're maybe about 70 years old, and you're having a party that has celebrated your career. You're retiring, you're all done with your ABA career and your work. And your friends are there, and your family and your colleagues are there, and they're giving speeches to honor you and the work that you have done. And then I want you to imagine that your most difficult cases, like your most difficult clients, what if they were there too at the party? And what if you were able to behave as compassionately as you could from this day until then? What are some words that those clients would say about you? And there's no right or wrong answer, but just spend a little time thinking about it. Not the easy clients that are no problem. That's covered, you got that. But the hard ones, what would they say? And write those words down and return to those words, because they can be a guidepost for you. They can be a compass that can help steer you towards finding new strength and new courage to show up with compassion. The next procedure from the acceptance and commitment training literature that I want to talk about is called acceptance. You can also think about it as willingness or vulnerability or courage. And it's the practice of choosing discomfort on purpose when it helps empower you do something that you really care about. So choosing to suffer a little bit on purpose as an ABA professional, when that suffering helps you do something that you truly care about. And so on slide 24, I want to ask you to do a little exercise. And if you're willing to, this could hurt a little bit. It hurts me a little bit when I do it. But I want to ask you to remember the face of someone who believed that you were cold or uncaring with them, even if you weren't, even if they are unreasonable, or even if they were wrong. But their honest belief was that you were cold with them, or that you did not care about them. And just remember their face a little bit. See if you can make room for that memory. And if you're like me, it hurts. It feels ugly, feels painful. And I can remember some families that I've worked with that if I could take a time machine back in time, I would do things different. I would do things different. And I cannot travel through time. What can I do? I can choose different behaviors starting right now, starting today. I can choose to put human dignity and kindness before data and science. And you can make whatever choice you choose. And so I invite you to think about one small behavior change that maybe you would be willing to do for the future. One small thing. Okay, the next bit from ACT that I want to talk about is present moment awareness. And so all major spiritual traditions include some reflective practice. Some religions call it prayer, some call it meditation, some call it mysticism, but almost all cultures in the world have figured out that taking time to practice being fully present with what's happening in my life here and now helps. It makes us stronger. It helps us do things that are really important. And so the way to do this is there's many different ways to do it, but the easiest way that most people start with is just start by noticing our own breath. And so you can take a deep breath and let it out slowly. And just notice where that shows up. Notice it in your chest, maybe in your lungs. Notice what you hear and see. And when you notice your attention wander away from here and now, bring it back. And so if I'm practicing this present moment skill with you right now, I am putting my full attention into this conversation with all of you. So I'm noticing Amr's face. I'm noticing my own voice, and I'm paying attention. And when I notice that my attention wanders away, maybe a truck drives down the street in front of my house, then I bring my attention back to here and now. And that's okay. We will get distracted. And then we bring our attention back to here and now. And on slide 26, there's a picture that reminds me of this. And it reminds me of a quote that the most beautiful gift that we can give another human being is our complete and full attention, to share a moment with them completely and fully. And so what does this mean for our work in ABA? It means that we can practice when we notice that we're becoming stressed or frustrated or tired or even angry sometimes. We can notice that and then bring our attention back to the human being that we're working with. And so if we're working with a child, the child has our full attention. And when we notice that we're thinking about the data or the protocol or other people's judgments of me, I redirect my attention back to this moment with the child, because every moment that we spend with that child is the most important moment. It's a gift. It's a gift that the family is giving us, that we can spend that moment with that child. And when we fully show up for that moment, we can do our best. And the same is true with the parents that we work with. When we're training a parent or having a difficult conversation with a parent, maybe we notice in our head we're having thoughts like, you don't understand, or why won't she listen to me, or they don't like me. Maybe they think that I'm not professional or something, I'm not good enough. We notice those thoughts, and then we bring our attention back to that human being. And we fully be there with that person in that moment. Why? Why is this related to compassion? Because we notice, human beings notice when other human beings show up for us. You can't ignore it. If it's real, it has to be authentic. But when we're willing to be fully present with another human being, we share their experience. And we're giving them a gift of love and support in that moment. Okay, let's talk about a few more specific concepts and procedures that could be useful. Just one, I'm on slide 29. One concept is ableism, and it's just a kind of bias or discrimination that shows up where we treat people different if they have a disability. And maybe I don't know about Arab culture and Middle East culture, but in the United States and in the West, there's a long history of mistreating people with disabilities and treating people with disabilities like they are less than people who do not have disabilities. Like all bias, it's still there. Even if we think that it isn't, it's still there under the surface. And so it can be very empowering for us to just reflect when we're choosing behaviors to change, when we're choosing how to interact with our clients. Just reflect on, I wonder if their label or their diagnosis is influencing my behavior with them. And if we notice that it is in a negative way, then maybe we can take that as an opportunity to refocus on what they truly care about and what they want. One really interesting area that I recommend reading about, if people have not already, is called the social model of disability. And it's a way of conceptualizing disability from the standpoint of how society creates and constructs disability and how we talk about it. And so if you look on slide 30, there's a cartoon with a person in a wheelchair and a set of stairs. And the sign says, here's the way in. Everyone's welcome, but there's only stairs. And so the person in the wheelchair, they're not really welcome. And the traditional medical model of disability would say, her legs are the problem, let's fix them. And that's good. If we can, that's a good idea, right? But the social model of disability would say, well, hang on, the stairs are the problem. We can build a ramp. And if we build a ramp, that person is fully included. They can be present with everyone else, even if their legs cannot be fixed. And so why is this relevant to autism? Well, many of the things that we choose to work on and that society tells autistic people that they need to change are really because society thinks you're supposed to act that particular way. I have many friends and colleagues who are autistic, and they say, we don't, in our culture, when autistic people interact with other autistic people, we don't have to do the social skills that you neurotypical people think are so important. We don't have to look at each other in the eyes. We make space for us to have unique and different social behaviors, and there's less judgment. So it would be nice if all of the world was like that, but it's not. So of course, we do need to empower our clients by teaching them new skills and new behaviors that will help them be successful in society. And also we can do that while acknowledging that society can be more accepting and more inclusive at the same time. And a major area for this is repetitive behavior or stereotypy. I don't know if you guys use the word stereotypy, but repetitive sort of automatically reinforced behaviors. There's a long history in the ABA field of if an autistic child is doing repetitive behavior, we have to make them stop. And autistic people are telling us now, you don't need to make us stop. We can stim while we also pay attention. We can hand flap while we also listen. And so this is interesting. There's actually very little research in ABA, very little science that has told us we have to make stereotypy or stimming go down. So really it's our responsibility as ABA professionals to look individually at each client and ask the question with some good data, are they able to pay attention and learn even while they're also doing their stimming or stereotypy behaviors? And we can test that out. If the child is making progress in learning while they're also hand flapping and rocking, great. If it's not working, if they can't pay attention and listen, then maybe we should try to help them decrease those behaviors. But the starting point in ABA for decades has been get rid of the behavior first. And there isn't any research to support that. And honestly, autistic people are telling us that is part of our identity. It's what we like to do. You can't take that away from us if you don't have to. And so I don't know about all of you, but I do a lot of like fidgeting behaviors, like doing this with my hands, or maybe moving a little bit in my seat, or maybe playing with my keys in my pocket. These are all stereotypy, and they're not causing a problem. And so if someone wanted to make me stop, I would not appreciate that. And if I did need to change those behaviors because they did actually get in the way of something important, then okay, I would be open to that. So let's see, Amr, I think we only have 5 minutes left on the scheduled time, but I actually don't have another appointment right away. So it's okay with me to stay for another 15 or 20 minutes if people want to.
Yeah, definitely. We are waiting you, doctor. So just take your time. Whenever you want to finish, you just finish.
Cool. And if people need to go, if they need to go to work or go to their family, I will not be offended. It's okay.
They are all here. They are waiting since long time, so they are enjoying.
Okay. Very good.
Thank you.
Okay. I would like to read a quote from a research paper or a discussion paper that we are publishing right now in the journal Behavior Analysis in Practice. And it's a position paper on compassion in ABA. And the first author is Christine Rodriguez, and I am the second author, and my wife is the third author, Courtney Tarbocks. And the three of us wrote this paper. We've been working on it for 2 years, and it's going to be published very soon. But I want to read a quote from it, from Christine Rodriguez. She says, behavior analysts foster human connection, comfort, and safety. Even during the most difficult of times, behavior analysts make it clear to others that they are safe and they are valued. Behavior analysts do not knowingly create contingencies that trigger intense escalation or loss of dignity in their clients. And so this is, I don't think it's an accurate description of who we are today as a profession. This is an aspiration. Yeah. This is a dream for our future. And I think we can get there. And so I want to talk about a few specific ways to do it. So first, I just want to ask the question, when do we need to cause escalation in behavior? When do we as professionals need to make an autistic child have a meltdown, have a huge tantrum, aggression, screaming, crying, laying on the floor? When do we need to make them do that? And I'll tell you what I was trained on 25 years ago was that it's good for the child when we make them have a complete meltdown tantrum, because the child learns they cannot escape. They have to do the work. The child learns to be compliant. And back then, I believed that. It made sense to me, because if a child is compliant with education and teaching, they will learn more. And if they learn more skills, that will empower them to do more things that they care about in their lives. And I think there is some truth to that. And also, are we really sure that we need to do that? Are we really sure that we need to make a human being completely lose control of their body and scream and cry and lose their dignity? I don't think we need to. And it turns out there's no research that shows we need to do that. There are no studies that show provoking full meltdowns works better than kinder and compassionate approaches. And if you've had Greg Hanley, you know that Greg Hanley says he is no longer willing to make a child have a huge meltdown. He's just not going to do it. He's not going to do it. And he is probably the most famous person in the world in ABA right now. So if that's good enough for him, it's good enough for me too. And so what does this mean for what we can do? And so let's see. I want to talk about the concept of assent. And so assent is a new concept in ABA, but it's not new in other professions. And assent, well, let's back up. So parent consent is what we've always focused on in ABA. And that means if the parent gives consent and signs a form that says, yes, you have my permission from parents, then you can do these procedures with my child. And as long as the parent gives their consent, then we're okay as clinicians, as professionals. But assent is different. Assent is the child themselves giving us permission to do those procedures with them. And so what it means is the child shows us either through words or through their body, if they don't have words, that they are okay with what we are doing, that they choose to allow us to do ABA with them. And I want to read you a quote from the American Academy of Pediatrics. And yes, I know this is specific to the United States of America, but there's lots of doctors, medical doctors, who are very smart, who have worked very hard on this. And so I think it's worth us in ABA thinking about what they have to say. And so what they say is, this is slide 35. What they say is, pediatricians should always solicit children's assent, meaning doctors should always ask the child if it's okay. Is it okay if I touch you right now? Can I feel your belly to see how your stomach is? Can I put my hands on your knee and feel, is your knee okay? They should always ask for the child's permission. And then when they have to do something where the child does not give them permission. For example, if you have to get a shot in your arm, right? Get a shot, an injection, and the child says no and cries because they're scared, but the child needs that procedure for their health, then the doctor should apologize. So the doctor should say, I'm really sorry. I have to give you this shot. I know you don't want it. I'm sorry, and you have to have it. And they make them have it. Okay, they need it, right, for their health. But the doctor has to apologize. What would that look like in ABA? The way that I was trained in ABA 25 years ago was escape extinction, which means you tell the child to do something. If they refuse to do it, you make them do it. You place your hands on their hands and you physically guide them to be compliant with your demand. If we took this assent seriously, we would have to apologize to the child and say, I'm really sorry, I'm going to make you do this. ABA people don't do this. We could do this. We could do this. And so here's a question. Do we want to be more like dictators or police who force autistic children to be compliant? Or do we want to be more like a nurse or a mother who cares for the child and inspires them and makes them feel safe? And I think the answer is clear for us, right? So there's an area that we can improve on. And so how do we do this? How do we respect the child's assent? So I'm on slide 36 now. And what assent looks like is the child actively choosing to participate in ABA therapy. So it might be that they say yes. So if we ask the child, are you ready to work? The child says yes. If they don't have the word yes spoken, maybe they go like this. Maybe they smile. Maybe they move towards us. Maybe they do a sign language for more, right? Maybe they point to the work that they want to do, but they do an active behavior that indicates to us they want it. They are willing to try. Now, if we're serious about honoring child assent, that means we need to be serious about honoring when they withdraw or remove their assent. And so if we're working with the child and they do something that tells us they don't want us to work with them anymore in that moment, that's telling us something. That's telling us they don't want it. They're not okay with it. They could be frustrated with the work. They could be afraid of the work. They could be tired. They could be angry that we're telling them to work. All of these things are part of being a human being, right? And so if they are telling us no thank you, either with words or with their bodies, what does it tell us? It tells us that we are using negative reinforcement, that what we are doing, the way that we are operating in their environment is non-preferred, or the technical term is aversive. And so if withdrawing work is a reinforcer for the child, that means we are using negative reinforcement. And it's okay for us to use negative reinforcement sometimes. It is one of the major learning principles. It's part of how humans work and interact in the world, but it's our ethical responsibility to maximize positive reinforcement as much as possible, so that our learning interactions with the child are based on what the child really wants, not what they want to avoid or move away from, but what they want to move towards. So that when we change their environment, it changes it in a way that makes them inspired and happy and excited, not frustrated, tired, and afraid. Okay. So there's some programs that, at least in the West, in the United States, have traditionally been very difficult for a lot of autistic children, and that may be based more on just compliance and negative reinforcement. And so things like eye contact, we used to think that we have to make the child look at us before we can present an instruction. And you know what? There's almost no research that actually shows that that's necessary. It was an assumption that was made decades ago, and it kind of makes sense, right? If you're not looking, maybe you're not paying attention. If you're not paying attention, you can't learn. That kind of makes sense. But again, many autistic people are telling us that's not true. It hurts for me to look at you. Eye contact is aversive for me. And so if I look down, I can actually listen better with my ears. And if I look at the table and the materials, I can focus better than if I have to look at your eyes. Maybe this is true, maybe it's not true, but it's our opportunity to think about that with each individual child that we work with. And we know how to collect data. And so we can take data and we can see, is it necessary to have the child look, or can we try teaching where the child does not have to look at our eyes? They can look somewhere else. And we can see, are they learning or not learning? We have data, we can test it. And if it doesn't work, we can go back to requiring eye contact. Another one is greetings, social greetings. In the US, it is very, very, very common in ABA clinics and ABA schools. Every time an autistic child is walking down the hallway and they see another person walking towards them, they have to stop, make eye contact, and say hi. Every time, they have to. And the ABA teacher or therapist or professional will prompt and prompt and prompt until the child is compliant and says hi. And they'll just keep prompting until the child says hi. Here's the problem. Yes, it's nice to have greetings, and it shows respect, and it shows that you see other people, and that's good. And also, if it's aversive for the autistic child to do that, and we make them do it by prompting over and over and over, what we're teaching them is to do a social behavior, but for the wrong function, for a negative reinforcement function, for an avoidance function. So what we're teaching them is you have to say hi to other people just to avoid being prompted by your ABA therapist. That's the wrong motivation. We want to teach human connection because it's a source of joy and positive reinforcement, not because I have to do it to avoid my ABA teacher bothering me and prompting me. Okay, what else can we do to help with assent? We can engineer the teaching environment to make learning more fun. And so we can make the task easier. We can build in the child's favorite interests into the task. So if the child loves trains, we have teaching stimuli that include trains. If the child loves science, then we include science somehow in the teaching materials. So we make the learning environment more fun. Some children learn better in less structured, play-based intervention, so we can do that. We can make the context or the antecedent for our teaching be play that the child actually loves, not that we think they should like, but what the child actually likes. And you already had Greg Hanley. I don't know if he talked about his enhanced choice model. Did he talk about that when you had Greg Hanley? Do you remember?
No, actually, he talked about the same, or like same, nearly. It's perspective to ABA today. It was mainly like, yeah, same, but he also talked a lot about how we should be human in treating children with autism.
Cool. Okay, so I highly recommend checking out his article. It's let's see, Dittu Rajaraman is the first author of the article, and it's called the Enhanced Choice Model. And Amr, if you remind me, I will just email you the PDF and you can distribute to everyone.
Yeah, definitely, Doctor. I will. Thank you so much.
Cool. Yeah, no problem. But his model, Enhanced Choice Model, they have 3 choices for the child. Choice number 1, work hard at the ABA table and get your favorite positive reinforcers. Choice number 2, leave the table and go play by yourself and still have some of your favorite toys. Not all of them, but some materials by yourself with no work, no demands, okay? Choice number 3, ask your mom to take you home and leave the ABA center. And at any time, the child can make those 3 choices and the child can change their mind. And so what they show, there's only 1 or 2 studies published, so it's very new, but what they've shown is if you use positive reinforcement that is powerful enough and linked to what the child really cares about, and you use synthesized contingencies of reinforcement, like in Greg Hanley's practical functional assessment model, that children will choose to work hard and earn reinforcement 95% of the time. And so, and why would that be? Because we're not making them do it. It's their choice. And it involves all of their favorite things. So they can be by themselves and not learn, but it's kind of boring, or they can try hard and learn and get their favorite things. It's a beautiful, beautiful model. It's very new, but I recommend you check it out. Read the article and have a look at it. Okay, I want to also talk about, I'm going to go to slide 43, and I want to talk about a procedure that my wife, Courtney Tarbocks, created. And it's a procedure for doing extinction with more compassion. And so I'm sure all of you know about extinction, and that's where the child is doing a behavior that's problematic. And we know, we figured out what the reinforcer is, and we don't give them the reinforcer. So if the child wants escape from work, we continue to make them do work. If the child wants food or a toy, we don't give them the toy, right? There's lots of research showing extinction works to decrease behavior. And also, it's very hard to do because it makes the professional feel bad. It makes the parent feel bad. And think about it from the child's perspective. Like if you ask me a question, right? Like a genuine, real question for me, and I just ignored you on purpose and turned my back to you like this, how would that make you feel? Terrible, right? And yet it's a common procedure in ABA. And so my wife, Courtney, asked the question, how can we make this procedure more kind? Maybe there's a way to make it more kind. And so she just asked herself, what do these kids want? They want to feel safe. They want to feel taken care of. They want to know that they're safe and that, you know, that they're in a nurturing environment. And so how do we do that with children? We just be nice to them. So is it possible to be nice to the child while also not giving them the reinforcer for the challenging behavior? And unfortunately, the way that extinction has often been done in the past is the child starts doing problematic behavior and the professional turns away and ignores and has no reaction to them and doesn't even acknowledge that the child's upset. And so what Courtney said was, let's just be really nice while we don't give them the reinforcer. And so, and we tested this across many kids, and maybe for one child, it was the iPad that the child really wanted. He wanted video games on the iPad. And he asked for it and said, no, not right now. I'm sorry, like we just can't have it right now. And so then he would start to scream or cry or have a tantrum. And the traditional extinction procedure would be to turn away because we don't want to accidentally reinforce the behavior with attention. But what Courtney tried was turning towards the child. And if the child liked to be picked up, she picked him up. If the child liked a rub on the back or a pat, she would do that. If the child liked hugs, she'd say, "Do you need a hug right now? I could tell you're really upset." And she would show that she saw his feelings. And so she would validate his feelings, and she still wouldn't give him the iPad. And so she might say something like, "Oh, I'm so sorry. I can tell you're so upset right now, and I just can't give you the iPad right now. I'm sorry. You can definitely earn it later, okay? We'll make sure you get it later, but you can't have it right now." And she would give him a hug. And what we wanted to know is, will this work? Will the challenging behaviors still go down? So take a look at slide 44. And this is multiple baseline across 4 children. And you can see with all 4 children, the challenging behavior went down substantially. It worked really, really well. And so first we tested it with just 4 children. And when we found that, yes, this works great, then she started training all of the professionals at her clinic. And now this is the standard procedure for extinction at her clinic called First Steps for Kids. So every client, when we have to use extinction, we do it by validating the child's emotions and providing some comfort and support, while we also don't give the reinforcer for the challenging behavior. And it's working great. Any questions on this procedure specifically?
Yes, doctor, there is a question said like about the kind extinction. If the behavior is maintained by attention, how can we validate this? Yeah, thank you.
Yeah, very good.
You have a very smart group. I was hoping no one would ask that question. No, I'm kidding. Yeah, so
they are the future of ABA in Middle East.
That's good. I love it. So that question we have not tried to answer with research yet. And so our best guess right now is if attention is the only function for the behavior, then our best guess right now is we validate the child's feelings, we explain why we can't give attention, maybe even apologize, and then we stop giving attention. And if the child has a meltdown and is having a really hard time, maybe we check back, maybe every minute or every 5 minutes, we check back with them and just say, "Are you doing okay? I could tell you're really upset still. I'm sorry, I still can't pay attention right now. I have this other thing I need to do, but I'll be back soon and I'll check on you," and then walk away again. Does that make sense? And so it's not pure extinction. It is giving a little bit of attention as a consequence for the behavior. But if you combine that with lots of attention for functional communication and lots of attention for other appropriate behaviors, what the child learns is, if I ask for attention, or if I work hard, or if I do other adaptive behaviors, I get a lot of attention. If I have a tantrum, I get just a teeny bit of attention. And so it might take a while, but we believe that most children will learn that and that it will work. But that's actually the next study that we need to do, is kind extinction for attention maintained behavior.
Dr. Jonathan, just a quick question here, please. Do you give alternatives, like, with older kids on the spectrum, if you have to really put the behavior on extinction, would you give the child or the young adults an alternative? Because if you are dealing, let's say, I deal with teenager group. So it's not like I can just ignore or just cute kid stuff. You're treating him with the age appropriate. So would the alternative thing would be here until we do this, or, usually we don't put the reinforcer with something extra, like this or that. We don't alternate them. What would you think?
Yes, I think that's really important. And thank you for that question, because I didn't specifically say that. And the general point is extinction should never be done by itself. There should always be other alternatives and other procedures in combination with extinction. And so, yes, the person, while they wait for your attention, they should always have something else they can do. Always. And if it's something that they like and they care about, then good. Maybe that will keep them busy, you know? And I think that's true of younger children too. Now, we want to be a little bit careful, because if we're giving them their favorite toy or favorite activity as a consequence for the behavior, maybe we will teach them, now just do that bad behavior to get that other, you know, consequence. So we have to be careful of that and take data and watch the behavior and see if it's increasing or decreasing. But yes, they should already have access to something else that they would like to do while they have to wait.
Thank you, Doctor.
Yeah, no, thank you for the good question. That's a really important question.
Cool, thanks.
Okay, yeah, just slide 45 would be a great activity for you all to do. Just maybe, what's today? Thursday, maybe on Monday or over the weekend, maybe think about what's one procedure that you do frequently, and just ask yourself, is there a way that I can do this procedure with a little bit more kindness or compassion? And just try it and take data and see, does it work? Is it more effective? Is it less effective? Or is it about the same? And compassion-focused ABA does not have to be more effective than traditional ABA, because it's more moral and it's more ethical. It can be equally effective, right? And still it's a good idea. And, you know, maybe even, I believe, we'll see, but I believe that more compassionate approaches to ABA will be more effective, because it's motivating our clients to want to engage the process. Okay, so parents and compassion, I mean, for sure, just looking, I mean, we've talked about this a lot already, but I've got a few slides on that. I want to talk a little bit about, so again, the Taylor, LeBlanc, and Nozick article from 2019 has great ideas for where to start, specific behaviors we can practice when engaging with parents to show compassion and empathy, making supportive statements, offering actions to take to alleviate their distress, just validating their distress. So if a parent shares that they're upset, just saying, I hear you. That sounds like that has to be really hard. And I know in different languages and in different cultures, there would be different ways to do that is appropriate. But I believe that the willingness to be a witness to someone else's suffering, that I think is universal. Okay, and then, oh yes, let's see. Hala has a question. Hala, did you want to, let's see, Hala Fuad, would you want to ask a question? Maybe it's the question in the chat. Let me see. If parents want us to teach a skill to their kid, but this skill needs some prerequisites, which is not in the client's repertoire. So we show empathy to parents and explain that we need some skills first, but parents still don't get it and insist on their demand. How can we deal with this situation? Yeah, that's very, very challenging. You know, I think you could try teaching the skill for a very short period of time with data and show, and have the parent watch and show the kid is struggling. He can't do it. And then say, look, let's just, and then, so in other words, try their way first. And if it doesn't work, then have a real honest conversation with the parent and say, we tried it your way. Here are the data. It's not working. And we can tell that your child's frustrated because we're asking him to do something that's too difficult. And then you could do some perspective taking with the parent. Like, can you imagine learning about, I don't know, you know, Einstein's theory of relativity or something before you even learned about gravity or something, you know? Can you, like, are you going to go run a marathon when you've never run 1 kilometer before? Like, it's not reasonable. Let's make it easier for your child. But yeah, it's going to be difficult for sure. Okay, so last thoughts. I think it's going to be tricky to move towards more compassionate approaches in ABA. But I think it's going to make us stronger. It's going to make us more effective as a field. It's going to make the families that we support want our services more. It's going to sustain us. And so I don't know if in your region, if you are experiencing burnout for professionals, where professionals are young and they work so hard and they try so hard, and then after a few years, they're just too tired and they can't do it anymore. Well, we have a lot of that in the United States. And compassion is a big piece of that. When people feel disconnected from their work and disconnected from the human beings that they're working with, that feeds burnout. It causes burnout. And so taking the time to reconnect with ourselves, with each other, our colleagues, and with the parents that we work with, and reconnect with our clients on a human-to-human level can help sustain us and help make us stronger when we're feeling tired and we're feeling fatigued. And so I would invite everyone here, if there's any ideas or procedures that you have felt inspired by or curious about, I invite you to take out a piece of paper or maybe your phone or whatever and take a note, and maybe even choose a day and maybe choose a client that you're going to try it with, whether it's kind extinction or compassion and empathy and parent training. But one small step that you would commit to, do one small thing differently, and then reflect and notice, how did it go? Did it work? Maybe not. Not everything works the first time. But if you make a small commitment to behavior change for yourself, that can empower you. And it's much more effective than just listening and thinking about something. I'm happy to answer a couple more questions if people have any more questions before I go. Or comments. Yeah, I love Mina's comment. We have to humanize our professional practices, being sensitive to parents and children's feelings and emotions, and it shows warmth. Yes, I really agree, Mina. That's beautiful. Okay, well, thank you very much for listening and for your great questions. And even though the sharing did not work, I think together we made it work. So thank you.
Thank you so much, Dr. Jonathan, for coming and for teaching us about this important approach in our practice, in our profession. And we promise you that we will spread all the words that you said to us today, and we are going to reflect this in our practices in teaching with our students, with our clients. We also want to base our ideas in ABA based on compassionate, and thank you so much. We are grateful to your time and your effort, and thank you so much.
Thank you very much.
Thank you so much, Dr. Jonathan. We really appreciate you taking time, and we love accepting commitment. I don't know if you've read also, this is for everyone, Wisdom, the Wisdom Factor.
Oh,
with
no.
Dr. Letal and Mr. Carlos Zuluaga. It's amazing. Yes. It's also and Dr. Letal, it's amazing. It's all about act and how we actually can make our life a better place and humane the whole aspect. It's just a beautiful book, and I think everyone should have a copy of it.
Thank you, Mrs.
And thank you so much, Dr. Jonathan, and we hope to see more of you. Mr. Amr, thank you so much.
Thank you so much.
Bringing us all together, and everyone around tonight. Allah yatikum alf afia. Good night. Thank you.
Thank you, Dr. Jonathan. Wishing you all the. Thank you so much.
Thank you. Bye.
الله يعطيكم العافية، إن شاء الله تكونوا استفدتم من
الله
المحاضرة.
يعافيك أستاذ عمرو.
الله يحفظك، والله
لا
المحاضرة
مش
قيمة، وأتمنى إن إحنا
ما شاء الله.
أتمنى إن إحنا نأخذ هذه الأفكار وننشرها ونطبقها مع طلابنا، ونطبقها براكتس في كل شيء compassionate. يعني أتمنى إن شاء الله بإذن الله تكونوا استفدتم من المحاضرة، وإن شاء الله ننتظر ضيوف آخرين ومكملين في رحلة الإيبي الجميلة إن شاء
شكرا
الله.
ليك أستاذ عمرو،
إن
بجد
شاء
يعني
الله.
بيك
الله يعطيك ألف عافية أستاذ.
بجد يعني يا أستاذ عمرو، شكرا ليك جدا
الله
يعني.
يعافيك وشكرا لكم، وإن شاء الله انتظرونا في محاضرة أخرى.
وناطرين السلايدز من عندك
السلايدز
أستاذ عمرو.
راح أدزهم لك إن شاء الله. أنا
بليز.
حاولت أدزهم على الماء.
خلاص شكرا.
راح أدزهم إن شاء الله. أوكي.
خلاص على الإيميل. يلا تمسون بخير ومع السلامة.
يعطيك العافية، مع السلامة.
نشوفكم على خير إن شاء الله. مع
مع
السلامة.
السلامة.
الله يعافيك. مع السلامة.
مع السلامة. يلا السلام عليكم. شوفكم في
وعليكم
المحاضرة
السلام ورحمة الله وبركاته يا دكتور.
إن شاء الله.
شكرا لتعبك ومجهودك
حبيبي.
والله وشكرا لكل حاجة بتعملها.
الله
بجد.
يعزك. أنا
جزاك
بعمل
الله
الحاجات دي.
خيرا.
أنا بعمل الحاجات دي لأن أنا فعلا بحب الإي بي إي، ولأن أنا فعلا نفسي يوصل لكل الأخصائيين، نفسي يوصل لكل الشباب الصغيرين. يعني بحسد الشباب
ما
الصغيرين
شاء الله.
النهارده اللي هم لسه في الجامعة أو أدي لهم سنة وسمعوا الإي بي إي وشافوا جوناثان تاربوكس وشافوا جريج هينلي.
ما شاء
يعني
الله.
يا ريتني وأنا صغير كنت شفت الناس دي. أعتقد يعني
والله
كنت
يا دكتور
أبقى في
واضح
حتة تانية.
ان رحلتك ورسالتك ماشيه ومكمله، لان انا شايف ما شاء الله الكم الهائل من الناس
الحمد
اللي
لله.
بيدخل وبيستفيد. اول
الحمد لله.
محاضره غير المحاضره بتاعت النهارده، غير المحاضرات ان شاء الله اللي جايه. الناس بتكتر ومش لاقيه يعني مكان عشان تدخل.
الحمد لله.
يعني انا حاولت كتير عشان ادخل، والله تقريبا
ده
40 دقيقه بحاول ادخل.
ربنا يرزقنا القبول. واحنا الرسالة بتاعتنا دي يا
الحمد
جماعة
لله.
دي رسالة
باذن
إنسانية.
الله.
يعني هي مجهود. أنا بقعد أبعت إيميلات وتجيلي إيميل وبتاع، بس هي الفكرة ورا أرابس توكي بي هي فكرة إنسانية. هنوفر المعلومة للناس. يعني شوف واحد زي جوناثان تاربوكس، راجل دكتور عظيم ليه عشرات الأبحاث، احنا جبناه النهارده سمعنا له، استفدنا منه في حاجة، في أفكار عندنا. فهي فكرة إنسانية راقية. إن شاء الله بإذن الله تكمل، وإن شاء الله بإذن الله نستضيف ضيوف تاني وثالث رابع عشان ننشر العلم ده، نفيد أكبر عدد ممكن من الطلاب ونفيد أكبر عدد ممكن من الأخصائيين. ده الهدف يعني.
بجد يعني جهود مشكورة دكتور عمرو، والله جهود مشكورة
ربنا
تشكر عليها بجد والله.
ربنا يحفظكم. وده يعني
واستفدنا
حب
كتير والله. احنا كل محاضرة يعني بنستفاد بصراحة، هم ما شاء الله عليهم بنستفاد منهم الكتير بجد في كل
طبعا طبعا. والحمد لله يعني ان شاء الله باذن الله. اهم شيء ان الناس تكون بتستفيد وبتتعلم، والحاجات دي كلها. الحاجه الجميله ان هي حاجات فري، تمام، تستفيد يعني. فان شاء الله باذن الله يعني ربنا يرزقنا الاخلاص، لان اهم شيء الاخلاص، ان الواحد يكون نيته خالصه
باذن
لله
الله.
عز وجل.
باذن الله.
وان شاء الله مكملين مع بعض. وان شاء الله بقى هجيب لكم حد بقى يعني، بس مفاجاه، بس يرد عليا
منتظرين.
بس. انا عمال احرجم عليه، انا عمال احرجم عليه من بدري، بس ان جه ده الراجل ده يبقى خلاص على كده. لان احنا ان شاء الله دي المحاضره رقم 19 ما شاء الله في اقل من سنه. عاملين كميه محاضرات ضخمه في اقل من سنه. ففي شهر مارس يوم 14 مارس هنكمل ان شاء الله 1 يير من عرب ستوكي بي. هنكون ممكن ساعتها نكون عملنا اكثر من 20 محاضره. بس يعني الجميل ان البرنامج ده ربنا فتح ليه القبول والقلوب، وبيحضر معنا ناس من كل
الحمد لله.
الدول العربيه، ناس بتحضر معنا من امريكا، الاستاذه اسماء من المانيا. فالحمد لله ده قبول من عند الله عز وجل.
دي من تركيا.
من تركيا. لسه كنت اقول براءه من تركيا. فربنا
مراكش.
ومراكش طبعا يعني، والاردن ما شاء الله.
من الأردن. الله يعطيك ألف عافية
الله
دكتورنا عمرو. الله يعطيك ألف عافية ومشكور. إن شاء الله في ميزان حسناتك. محاضرة جدا، وكل المحاضرات اللي أنت بتجيبهم والضيوف رائعين جدا.
الحمد لله.
عن جد شكرا جزيلا. شكرا جزيلا.
العفو. ده واجبنا الأخلاقي، والأشياء اللي احنا تعلمناها يعني الواحد يستفيد ويفيد غيره. فأنا مش هطول عليكم بقى كده، نروح بقى نعمل مظاهرة على الفيسبوك. بكره في العصر احط سؤال: ماذا استفدت من محاضرة دكتور جوناثان؟ عايز تعليقات بقى ايه نار.
لا كاتبين يا دكتور ما تقلقش.
لا احنا دلوقتي بكره العصر بقى مع سؤال كده: ما استفدت من محاضرة دكتور جوناثان؟ عايزينكم بقى التعليقات تبقى حكاية، مش هطول عليكم. حد عايز يسأل سؤال قبل ما نمشي؟ حاضر يا أمنية. هو الراجل محترم، الراجل عطانا السلايد وعطينا فري، فما تخافوش. هحط السلايد على لينك جوجل وهنشره وتقدروا تنزلوا المحاضرة. اوكي
ماشي يا دكتور، ربنا يبارك لك يا رب.
نروح نعمل مظاهرة على الفيسبوك بقى. يلا السلام عليكم.
حفظ الله، حفظ الله.
مع السلامة.
مع السلامة.